Hi, my name is Rafer Leach. I'm the medical director and founder of MSK Medical and ImageMD in Denver, Colorado. MSK Medical initially started as a post-traumatic injury clinic. I was an emergency physician and started to notice that we treated people very well for severe trauma in the ER. But when they got discharged home, there wasn't much of an opportunity for them to follow up with physicians that knew how to help them. And that usually entailed physical therapy and chiropractic and acupuncture and nutritional medicine to some degree. We had to use pain medications and certainly saw the problems with that. Eventually, more through my learning in integrative medicine, I realized there were some other opportunities to treat these patients. Aside from physical therapy, chiropractic, injection procedures, and even sometimes surgery, a lot of times the problems were sleep, fatigue, stress. Started to learn about high cortisol and the adrenal axis and thyroid dysfunction, depression related to different causes such as mineral deficiencies. So I've really widened my practice and then started a specific practice called ImageMD. What's really been enjoyable about this practice is I'm not committed to a busy emergency department where I just have limited time to see the patient. I can do just a full intake and full follow-ups. I can do laboratory evaluations that are uncommonly done by other providers, certainly in the general medical community. There's just some fascinating ways that we can look into the metabolic system, endocrine system, hormonal system, and then how they work together. And having the time to discuss why we're doing this, what we're going to do about our findings, and what the patient can do themselves and must do themselves to sort of have that relationship between myself and them that works for them and for us as doctor and patient. Bioidentical hormones have been a whole new opportunity for me to treat the patient. This is definitely both for men and women. We know that bioidentical hormone replacement is safe. It has to be done correctly, and it has to be medically directed, and it has to be measured, and people have to be followed up. And then the outcomes take care of themselves. When it comes down to our environment, there's just an infinite amount of toxicity that we are exposed to, and it's more education. There's some significant allergies that I think people need to be aware of, and we talk about gluten. This compound is very difficult on the gastrointestinal system, and the relationship to the GI system, to the brain, is very important. The transmission of toxins through the gastrointestinal tract is a significant concern, and I approach these type of difficult discussions with people. When you talk about eliminating something as standard as wheat, you definitely need to back it up with some evidence. The fact that it's primarily sugar, the fact that it is typically genetically modified, you start to impress upon the patient really what it is that they're eating, and once assumed was good for them and, quote, wholesome, really isn't. There's a lot of cravings, there's a lot of emotional eating, there's a lot of eating related to high cortisol. It creates high insulin, the metabolic syndrome. So we do spend a significant amount of time trying to eliminate sort of your classic big allergens such as wheat, dairy, but then certainly you have to investigate with more significant laboratory work to find out if there are some other things that might be causing their difficulties. If you'd like more information, my office is ImageMD, and that's imagemdco.com. And also for trauma-related treatment, it's mskmedical.com.